Instead of looking at your labs first, look at your hands. Why? Because both thyroid dysfunction and Sjogren's disease can show up in your fingernails long before, or even instead of, clear changes on standard blood work. The tricky part is that these two conditions can produce nail changes that look similar on the surface, but the underlying reason is completely different. One is a hormone problem. The other is an autoimmune, gland-destroying problem. If you know which signs point to which condition, you can walk into your next doctor's visit and ask for exactly the right labs. Let's break it down. Hit subscribe and leave a like. That helps this channel reach more people who need it. The goal at Health Inside is 200,000 subscribers, and every single person who joins moves us closer. And if you want the full Sjogren's symptom map guide with visuals, symptom breakdowns, and additional resources, type symptom map in the comments, and I'll send you the link to access it. Sign number 1. Missing moons versus dry, thinning nail plates. Look at the base of each nail. You should see a white half-moon shape called the lunula. Count how many you see across all 10 fingers. If you have fewer than 8, or they've disappeared from several fingers, that's often described as a missing moon sign, and it tends to track with low thyroid hormone. The theory here is that when your thyroid can't generate enough cellular energy, your body deprioritizes non-essential tissue like nails and hair, and the lunula shrinks or vanishes. Think of the lunula as the visible part of your nail matrix, the factory underneath your skin where new nail cells are actually made. That factory needs a steady, reliable supply of energy to keep working at full capacity. When your thyroid slows down, the factory doesn't shut off completely, but it does start rationing. And just like a business that's short on resources, it protects its core operations first and lets the storefront, the visible moon, fade into the background. This is part of why so many people with sluggish thyroid function feel like their whole appearance has changed, even when nothing life-threatening is going on. Hair thins. Skin dulls. And nails, quietly, lose their moons. It's rarely the symptom that gets someone to the doctor, but it's often the symptom that was there the whole time, waiting to be noticed. Sjogren's nails tend to tell a different story. Instead of the moons disappearing, you're more likely to notice the whole nail plate becoming thin, dry, and brittle, almost papery in texture. That's because Sjogren's is an autoimmune condition that damages the glands responsible for producing moisture and oil throughout the body. Not just your eyes and mouth, but the skin and nail bed too. So the moons may still be there, but the nail itself feels fragile and dehydrated, almost like it could crack if you bent it the wrong way. There's a useful way to think about the difference. Thyroid dysfunction tends to affect the engine that builds the nail, the energy supply behind the scenes. Sjogren's tends to affect the climate the nail grows in, how much moisture and oil is available once the nail is already there. One is a production problem. The other is an environmental one. That distinction matters, because it changes what kind of doctor you may eventually need to see, and what kind of testing will actually catch what's happening. If you counted your moons and felt your stomach drop a little, take a breath. Noticing this doesn't mean something is wrong with you, it means you're paying attention, and that's the first act of self-care. You are not imagining your symptoms. You are not just tired. Whatever your hands are telling you today, you're allowed to take it seriously, and you're allowed to be gentle with yourself while you figure it out. If that resonated, type moons below, just so you know someone else is nodding along with you right now. A quick note on how to actually check your own hands. Before moving through the rest of these signs, it helps to know how to look properly, since a rushed glance can miss almost everything described here. Check your nails in natural daylight if you can, rather than under artificial light, since warm indoor lighting can hide subtle color changes like yellowing or paleness. Look at all 10 fingers, not just your dominant hand, since some signs, like missing moons or ridging, can show up unevenly. Gently press on the tip of a nail and watch how quickly the color returns. This is a simple way to notice changes in circulation over time, especially if you do it consistently and compare how it feels month to month. And rather than checking once and moving on, it's worth building a habit of a slow, 5-second glance at your hands every week or two, the same way you might casually check your posture or your skin. Most of these signs develop gradually, so the goal isn't a single dramatic discovery, it's building enough familiarity with your own hands that a real change actually stands out to you when it happens. Getting to know your own hands isn't obsessive, and it isn't anxious, it's an act of care. You don't need to turn this into another thing to worry about. Just a quiet, steady kind of attention, the same way you'd check in on someone you love. You deserve that same gentleness from yourself. If you're going to start really looking at your hands this week, type noticed. Small habits like this one deserve to be celebrated, not just done quietly. Sign number 2, vertical ridges versus redness at the cuticle. Run a finger across your nail. Fine, raised lines running from tip to base are vertical ridges. In thyroid patients, these are commonly linked to poor nutrient absorption, particularly iron and B vitamins, because low thyroid function can reduce stomach acid, and stomach acid is needed to break down and absorb those nutrients from food. It's a frustrating cycle, because you can be doing everything right, eating a nutrient-dense diet, taking a multivitamin, drinking enough water, and still end up deficient, simply because your body isn't extracting what it needs from what you're giving it. This is one of the most overlooked parts of thyroid dysfunction. Most people assume that if their diet is good, their nutrient levels must be fine. But thyroid hormone plays a quiet, background role in nearly every digestive process, from the release of stomach acid to the movement of food through your gut. When that background process slows down, deficiencies can build for months or even years before they show up clearly anywhere else. Vertical ridging is often one of the earliest visible clues that this is happening, long before you'd notice fatigue, hair thinning, or other more textbook signs. With Sjogrens, the more telling clue isn't the ridge itself but what's happening around it. Redness, puffiness, or visible small blood vessels at the cuticle line, known as periungual erythema. This isn't a nutrient absorption issue, it's inflammation, plain and simple. The tissue surrounding your nail is being irritated by the same underlying autoimmune activity that's affecting your glands elsewhere in your body. Studies on nail changes across connective tissue diseases have found these nail fold and cuticle changes turn up more often in autoimmune conditions like Sjogren's than in simple thyroid-driven ridging. It's worth noting that researchers haven't established a definitive, exclusive link between Sjogren's and nail disorders, but people living with Sjogren's frequently report these nail problems. If you're trying to tell the two apart at home, look at where the damage seems centered. If it's running the full length of the nail evenly, with no particular redness or swelling near the base, that leans toward a thyroid, nutrient-driven pattern. If the area right around your cuticle looks angry, warm, or tender to the touch, even mildly, that leans toward an inflammatory, autoimmune pattern instead. If you've been told your labs are normal while your body keeps insisting otherwise, that disconnect is exhausting, and it's real. You know your own body better than any single number on a page. Trust that instinct. You showed up here looking for answers, and that persistence is going to be the thing that gets you the care you deserve. If you've ever felt dismissed by a normal result, type trust, as a reminder to trust yourself anyway. Sign number 3, nail splitting versus splinter hemorrhages. Look at the very tips of your nails. If they're peeling apart in layers, like the pages of a book coming loose, that's classic nail splitting, and in thyroid patients it's often tied to low T3, since T3 helps regulate oil production in the skin and nails. When T3 drops, oil production across your entire body tends to drop with it, which is also why so many people with low thyroid function deal with dry skin, dry hair, and cracked heels all at the same time as split nails. It's rarely just one area, it's usually a full body pattern that shows up in the places you're least likely to think to check. This is one of the reasons thyroid-driven nail splitting can be so persistent and hard to fix with topical products alone. You can moisturize the outside of the nail all day long, but if the oil-regulating hormone behind the scenes is still low, the nail keeps splitting because the underlying supply problem was never addressed. It's a bit like patching a leaking pipe from the outside instead of fixing the leak itself. It might help temporarily, but the root cause is still there. In Sjogren's, one distinguishing clue is the appearance of tiny, thin, reddish-brown lines running vertically under the nail. These are called splinter hemorrhages, and they show up more often in autoimmune connective tissue disease than in straightforward hyperthyroidism. These aren't caused by a lack of oil. They're tiny disruptions in the small blood vessels feeding the nail bed, which can happen when autoimmune inflammation affects circulation on a very small scale. They're easy to miss unless you're really looking closely, since they can look almost like a faint bruise or a stray hair caught under the nail. Another clue unique to Sjogren's: if nail changes are paired with persistent dry eyes, dry mouth, or difficulty swallowing dry food, that combination points much more toward an autoimmune gland problem than a thyroid hormone problem. This is often the single most useful distinguishing question you can ask yourself. Not what does my nail look like, but what else has been dry lately? Sjogrens rarely announces itself through nails alone. It tends to show up as a pattern of dryness across several parts of the body at once. Living with symptoms that don't show up clearly on a test can feel isolating, like you're carrying proof no one else can see. You're not alone in this, and you're not overreacting. Whatever is going on in your body right now, it matters, and you're worth the time it takes to get to the bottom of it. If you've ever felt like the only one who could see your own symptoms, type heard. You are, right here, right now. Sign number 4, slow, thickened nail growth versus onycholysis. Thyroid patients often notice their nails growing noticeably slower than they used to, and becoming thicker or more rigid in the process. This tracks with the overall metabolic slowdown that comes with low thyroid function. Cell turnover across the whole body, including nail cells, just happens at a slower rate. On average, fingernails grow a small amount each month, and most people never think about that number until it changes. But when someone with a sluggish thyroid stops needing manicures nearly as often as they used to, that's not a coincidence. It's a visible marker of a body that's conserving energy everywhere it can, including in tissue growth. Thickened nails can also become more prone to cracking along the edges, simply because thicker, more rigid nail tissue is less flexible and less able to absorb small everyday bumps and impacts the way a healthier, more pliable nail can. It's a subtle shift, but one that adds up. Nails that used to bend slightly under pressure now crack instead. In Sjogrens, keep an eye out for onycholysis instead, the nail plate lifting or separating away from the nail bed, usually starting at the tip and working backward, sometimes leaving a visible gap where you can see light, or even air, underneath the nail. Onycholysis has several possible causes, including certain medications and infections, but it's been documented in Sjogrens patients, particularly when the nail bed is chronically dry and fragile. The nail bed relies on a certain amount of natural moisture to stay adhered to the nail plate above it. When that moisture is chronically reduced by autoimmune gland damage, the glue holding the two together simply doesn't hold as well. One important note here, onycholysis can also be caused by things that have nothing to do with either thyroid or Sjogrens, trauma, certain nail polishes, fungal infections, or reactions to medication. So this sign on its own isn't a confirmation of anything. But paired with other clues on this list, especially dryness elsewhere in the body, it becomes a much stronger piece of the overall picture. Healing isn't always fast, and it isn't always a straight line, and that doesn't mean you're doing anything wrong. Slow progress is still progress. Give yourself credit for every small step you take toward understanding your body, even the ones that feel too small to count. If you're in a slow season of healing right now, type patience, as a reminder that slow still counts. Sign number 5, spoon-shaped nails versus yellow nail changes. If your nails curve upward at the edges so a drop of water would sit in the middle, that's colonicea, or spoon nails. In thyroid patients this is usually tied back to the same iron absorption chain as vertical ridging: low thyroid function, low stomach acid, low iron. Iron is essential not just for energy and red blood cell production, but for the structural integrity of the nail itself. When iron stores run low over a long period of time, the nail plate can actually start to change shape, not just texture, because the underlying protein structure isn't being built the way it should be. Spoon nails are one of the more dramatic-looking signs on this list, and they tend to alarm people the first time they notice them, which is understandable, since it's a visible structural change rather than just a surface texture issue. The encouraging part is that when spoon nails are tied to iron deficiency, they often improve once the underlying deficiency is addressed and iron levels are brought back into a healthy range under a doctor's guidance. Sjogrens has its own distinct nail color clue, a yellow, thickened appearance across multiple nails. This is sometimes described as yellow nail syndrome, and research has specifically linked it to Sjogrens patients who test positive for anti-SSA and anti-SSB antibodies. It's considered rare, but it's a distinctive enough pattern that it's worth mentioning to your doctor if you notice it. Yellow nail syndrome can also involve slower nail growth and a loss of the cuticle altogether, so if you notice several of these features together, yellowing, thickening, and a cuticle that seems to have disappeared, that combination is worth flagging specifically, rather than describing it generally as "my nails look off." It's worth remembering that yellow nails can have plenty of other simple explanations too. Nail polish staining, smoking, or fungal infections are all far more common causes than any autoimmune condition. Context matters here more than almost anywhere else on this list. Yellow nail syndrome tied to Sjogrens tends to appear alongside other Sjogrens symptoms, not as an isolated, standalone finding. Rare doesn't mean unimportant, and it doesn't mean unheard. If your symptoms don't fit the most common story, you still deserve someone to take them seriously. Keep advocating for yourself. You know things about your own body that no chart or textbook does. If your symptoms have ever felt too rare to matter, type valid, because they matter here. Sign number 6. Brittle, pale nails versus color-changing fingertips. Thyroid-related nail brittleness tends to show up as an overall dullness, nails that are pale, weak, and prone to breaking evenly across the nail rather than in one specific spot. This kind of brittleness often comes with a change in color as well. Nails can look almost washed out, lacking the healthy pink undertone that comes from good circulation and adequate thyroid hormone. It's a subtle enough change that most people don't clock it as a symptom at all. They just think their nails have always been like this, without realizing the pattern actually started at some specific point. This pale brittleness is closely tied to the same energy conservation pattern discussed earlier. When your thyroid is underfunctioning, circulation to less critical tissue can be reduced, and nails, being about as non-essential as tissue gets, from a survival standpoint, are often among the first places that reduced circulation becomes visible. Sjogrens is frequently accompanied by Raynaud's phenomenon, where your fingertips, and the skin around the nail, change color in stages, turning white, then blue, then red, usually triggered by cold or stress. This isn't a subtle, gradual dullness like thyroid-related brittleness. It's a distinct, often dramatic color shift that can happen within minutes. Some people describe it as their fingers turning off briefly, going numb and pale, before color rushes back in as circulation returns. If you notice this color cycling pattern in your fingertips alongside nail changes, that's a much stronger pointer toward an autoimmune, circulation-related cause than a thyroid one. Raynaud's on its own doesn't mean you have Sjogren's. Plenty of people have Raynaud's with no autoimmune disease at all, but when it shows up together with dry eyes, dry mouth, and some of the nail changes described earlier in this list, it becomes a much more meaningful clue to bring to a rheumatologist. A body that changes color, aches, or reacts to cold isn't a body betraying you, it's a body trying to communicate. It's okay to feel frustrated by that. It's also okay to feel hopeful. You are allowed to hold both, and you are allowed to keep asking questions until you get real answers. If you've ever felt frustrated with a body that seems to work against you, type strong, because getting through hard days with it still counts as strength. Sign number 7. Nail clubbing versus abnormal nail fold capillaries. Nail clubbing, where the fingertips widen and the nails curve down over them like a rounded dome, is a less common thyroid sign, but it does show up in some thyroid conditions, most notably thyroid acropathy, seen with Graves' disease. Clubbing tends to develop gradually, over months or years, which is part of why it's so easy to miss. There's no single dramatic moment where your nails suddenly look different, just a slow curve that creeps up on you until one day you notice your nails simply don't look the way they used to. Because clubbing can also be associated with certain lung and heart conditions, it's a sign that's always worth mentioning to a doctor regardless of whether you suspect a thyroid issue. It's one of those nail changes that benefits from a broader medical conversation, not just a thyroid-specific one. For Sjogrens, doctors sometimes look at the skin fold right at the base of the nail under magnification, a technique called nail fold capillaroscopy, and find abnormal, dilated, or irregular blood vessels. You won't be able to see this with the naked eye, but if you notice small red or purple streaks near your cuticle, or unusual sensitivity in that area, it's worth asking your doctor to take a closer look. This test is more commonly used by rheumatologists than general practitioners, which is part of why it so often gets missed in a standard checkup. It's simply not part of the typical exam most doctors are trained to run unless autoimmune disease is already suspected. Nail fold capillary changes have been studied specifically in connective tissue diseases, including cases where Sjogren's overlapped with, or was initially mistaken for, other autoimmune conditions. This is a good reminder that autoimmune conditions can sometimes look like each other on the surface, which is exactly why a rheumatologist's detailed exam, rather than a quick glance, matters so much when these kinds of symptoms are in play. Some of the most important clues in your health are invisible to the naked eye, and that can feel scary, like you can't fully know what's happening inside you. But you don't have to have all the answers today. You just have to keep showing up for yourself, one question at a time. If not knowing everything feels unsettling, type curious. That's all you need to be today. Sign number 8. Flaking cuticles versus chronic hangnail cracking. Thyroid-driven dryness tends to affect the whole nail structure fairly evenly. Cuticles that flake, along with the ridging, splitting, and slow growth already mentioned. This is, once again, a reflection of that same full-body oil and moisture regulation that T3 is responsible for. When it's low across the board, the cuticle, which is really just a thin, protective strip of skin, dries out right along with everything else, flaking and peeling in small, often painless pieces. Because this kind of flaking tends to be mild and gradual, it's frequently dismissed as just dry skin or the weather, especially in colder months. But if you notice it happening consistently, regardless of season or how much lotion you're using, it's worth considering as part of a bigger pattern rather than an isolated cosmetic annoyance. With Sjogrens, the dryness is often more localized and relentless. Cuticles that crack and split into hangnails again and again, no matter how much you moisturize, because the oil-producing glands feeding that tissue are the ones under autoimmune attack. This is a meaningfully different experience than simple dry skin. It's not that the cuticle needs more moisture, it's that the glands responsible for producing that moisture in the first place aren't functioning the way they should. No amount of lotion can fully compensate for glands that have been damaged by ongoing inflammation. If lotion and cuticle oil aren't fixing a persistent hangnail problem, that's a clue the root cause may not be simple dry skin. This is one of the more practical, at-home ways to start distinguishing between the two. Thyroid-driven dryness tends to respond, at least partially, to good moisturizing habits. Sjogrens-driven dryness tends to shrug off even diligent moisturizing, because the problem isn't a lack of product, it's a lack of the body's own ability to produce what the skin and nails need. It's worth giving any moisturizing routine a fair, honest trial before drawing conclusions. A few days of inconsistent lotion use isn't a real test. Try a genuinely consistent routine, applied a couple of times a day for 2 to 3 weeks, and pay attention to whether the cracking meaningfully improves, stays exactly the same, or barely budges. That kind of consistent, honest self-experiment can give you real information to bring to a doctor, rather than a vague impression formed after one bad week. If nothing you try seems to fix the dryness, the cracking, the little frustrations that pile up, please know that's not a personal failing. Your body is doing its best with what it has, and so are you. That's enough. You are seen, exactly as you are, symptoms and all. If you felt like you're doing everything right and still not seeing results, type seen. You are, symptoms and all. Why both of these get missed in a standard checkup? It's worth pausing to ask why nail signs like these aren't already part of a routine exam. Part of the answer is simply time. A standard primary care visit is often built around a narrow list of complaints, and unless you specifically bring up your nails, hair, or skin, there's rarely a moment built into the appointment to look closely at them. Doctors are trained to prioritize the symptoms that sound most urgent, and my nails look a little different lately tends to get filed under cosmetic concerns rather than diagnostic clues, even when it shouldn't be. Part of the answer is also specialization. Thyroid hormone levels are typically managed by primary care doctors or endocrinologists, while autoimmune conditions like Sjogren's usually fall under rheumatology. Nail changes sit in an odd in-between space that doesn't clearly belong to either specialty, which means they can slip through the cracks unless a patient brings them up directly and asks for them to be taken seriously. And part of the answer is that a single TSH test, while useful, was never designed to catch everything. TSH reflects your pituitary gland's response to thyroid hormone, not necessarily how much active hormone is actually reaching and being used by your tissues. Similarly, a general checkup isn't designed to catch autoimmune activity unless there's already a strong clinical suspicion prompting more specific antibody testing. Both conditions can exist quietly in the background for a long time, showing up in small, easy-to-dismiss ways, like your nails, long before they show up loudly enough to demand attention on their own. This is exactly why paying attention to your hands can matter so much. You're not trying to diagnose yourself. You're trying to notice patterns early enough that you can ask better questions, request more specific tests, and get a fuller picture sooner rather than later. It's not your job to be your own doctor, and it never has been. It's okay to feel tired of explaining yourself, of chasing answers, of wondering if anyone's really listening. You're doing something brave just by staying curious about your own health instead of giving up on it. That matters more than you know. If you've ever felt tired of explaining your own symptoms, type advocate. You're doing that for yourself right now, and it counts. What each pattern is telling you. If your signs point to thyroid, missing moons, ridging, splitting, slow thick growth, spoon shape, or pale brittleness, without much happening around the cuticle. The story is usually about T3. Many people on levothyroxine, T4 only medication, have a hard time converting T4 into active T3, and can have a normal TSH while their free T3 is actually low. That's worth flagging to your doctor. It's also worth remembering that thyroid dysfunction rarely produces just one sign in isolation. It's far more common to see 2 or 3 of these patterns overlapping at once, since the underlying hormone deficiency tends to affect several tissues in similar ways at the same time. If your signs point to Sjogrens, cuticle redness, splinter hemorrhages, onycholysis, yellow discoloration, color-changing fingertips, abnormal capillaries, or relentless cuticle cracking, especially alongside dry eyes or dry mouth, the story is about autoimmune gland damage, not a hormone conversion issue. Nail changes alone can't diagnose Sjogrens. They're a supporting clue, not a standalone test. The most useful thing you can do is track the pattern over time, when it started, whether it's gotten worse, and what else has changed alongside it: dryness, joint discomfort, fatigue. Since that timeline is often more helpful to a doctor than any single symptom on its own. It's also entirely possible to have overlapping features of both conditions, since autoimmune thyroid disease, like Hashimoto's, and Sjogrens are both autoimmune in nature and are sometimes found in the same person. If that's the case for you, don't feel like you need to force your symptoms into one category or the other. Bring the whole picture to your doctor and let the lab work sort out what's actually driving what. You don't have to have it all sorted into neat categories to be taken seriously. Overlap, uncertainty, and gray areas are still valid places to be. Wherever you land in this, you're not too complicated, too much, or too hard to help. You're just a person figuring things out, and that's more than okay. If your symptoms don't fit neatly into one box, type whole, you don't need to be simple to be worth understanding. What this means for your labs. Standard thyroid panels, TSH alone, can miss a lot, and standard checkups can miss Sjogrens too, since it often gets mistaken for just dry eyes or general aging. If your nails are raising questions, ask your doctor for a broader workup. For thyroid, TSH, free T3, free T4, reverse T3, thyroglobulin antibodies, thyroid peroxidase antibodies, plus serum iron and ferritin. For Sjogrens, anti-Rho SSA and anti-La SSB antibodies, ANA, and, if your doctor recommends it, a Schummer test for dry eyes or a salivary gland evaluation. Bringing a written list of your nail observations to your appointment can genuinely help. Doctors see a lot of patients in a short amount of time, and a specific, organized description, missing moons on 8 fingers, cuticle redness on both thumbs, and dry eyes for the past 6 months, tends to get taken far more seriously than a general "my nails have looked bad lately." You know your body's timeline better than anyone flipping through your chart for the first time, so don't be afraid to advocate clearly and specifically for the tests you think you need. It can also help to take a few clear, well-lit photos of your nails over time, one set now, and another set in a month or 2. Nail changes tend to be gradual, which makes them easy to underestimate in the moment. A photo comparison can make a subtle shift feel a lot more concrete, both for you and for the doctor you eventually bring it to. If you're tracking multiple signs at once, jotting down a simple date next to each observation, when the ridging started, when the color changed, when the cuticle first cracked, gives your doctor something closer to a timeline than a single snapshot, and timelines are often what turn a vague concern into a targeted, useful lab order. Your nails aren't a diagnosis on their own for either condition, but they are a legitimate reason to ask for the right tests instead of settling for "your labs look fine." Whichever direction your signs are pointing, remember that this list exists to help you ask better questions, not to replace the conversation you have with your doctor, and not to make you feel like you need to have it all figured out on your own. Bodies are complicated, and a handful of nail changes rarely tell the whole story by themselves. But they are often the first honest thing your body says before anything else catches up. Paying attention to them isn't overthinking, it's just good, early listening. However this journey unfolds for you, please remember this: you were worth listening to before you had a diagnosis, and you're worth listening to now. Whatever your hands, your labs, or your doctors eventually tell you, you are not alone in this, and you are not too much. You are seen. And you're going to be okay. If you made it this far, type "seen" one more time, because you are, and this whole list was for you.